Hi guys, we're going to go ahead and get started. We're going to be covering over chapter 40 today, which is Patients with Special Challenges. If you're following along in your textbook, we're going to be starting on page 1209 or 1210. You can look over your key terms as well as some of your chapter objectives before we get started. Some of the lesson topics we're going to be talking about today is really just patients with special challenges. So we're going to be talking about patients who have sensory impairments, patients with cognitive impairments, paralysis, obesity, homeless, or maybe even impoverished. Patients who are going through abuse, human trafficking, domestic violence, and really a big topic today as well as technology dependence. And we have so many different types of things, right? And these are patients who need technology as part of their care, and they're using technology almost in their everyday lives, either to help keep them alive or help them to deal with certain medical conditions they might have. So, as you can see, there's quite a bit of different technology dependencies that we'll be talking about today. We're going to start off with a case study introduction. So I'm going to go ahead and read it. You guys can follow along. EMTs Alice Combe and Tristan Mullins arrive on a call for a patient whose home ventilator alarm is going off. They are met at the door by the patient's mother, who says she has tried to determine the problem, but the alarm keeps going off. She tells the EMTs that her 23-year-old son has been ventilator dependent since becoming a quadriplegic in a car accident 8 years ago. I'm going to go ahead and move on to the next slide. There's a couple questions here. I suggest that you take your time, go ahead and pause the video, and answer the questions dealing with the previous assessment. If you need to rewind to look at the assessment, go ahead. Moving on, we're going to get into the introductions. Again, we've already gave you a brief introduction. Again, like I said, we're going to be covering medical technology as well as patients with special challenges. And we'll be going through a couple of these different special challenges as well as different technology we'll see in the field. There's a lot of patients who can have special challenges. They can have special challenges as a result of medical problems as well as trauma problems that they've had in the past. Some of them might be what we call congenital, which means they've had it since they were born, maybe birth defects or whatnot. Some of them are due to abuse or maybe even neglect, and lots of things that we really have to look into and do our best as EMTs to get a history. We're going to start today with sensory impairments. What type of sensory impairments, right? What are we talking about here? Well, obviously the basic ones, you guys, are hearing problems, vision problems, and then speech problems. So pretty simple. And if you guys have ever worked with a patient who's been deaf before, you might understand how to do this. If you guys have ever worked with a patient who's been blind before, right? Maybe you've had some experience in that situation, and that will really pay off in the future. And then lastly, you guys will have patients who have speech problems, whether that's from maybe past strokes or trauma or maybe even just congenital problems. And we'll talk about all of those things today. So we're going to start with hearing impairment, right? So deafness, I'm sure you guys have heard, is the inability to hear. You guys should probably know. Now, not all patients are all totally deaf, right? Some of them can be just partially deaf. Some are maybe only deaf in one ear. So you have to look and you have to talk and you have to assess your patient. If you start screaming at every single patient who's just partially deaf, they're going to think you're weird. Or if they're only deaf in one ear, they're going to think you're weird. So treat them with respect, treat them like a normal person, and just start to do your assessment. You will have to think about what are some tools or what are some things that I could use at my disposal to help communicate with this patient. Because when it really comes to be getting a history or getting a sample history on this patient, it might be difficult to ask them questions. So take your time and go ahead and assess this patient. Vision impairment are going to include other things, right? Now, this can be anybody who's just maybe had a little bit of vision loss to a patient who's completely blind. Some of these, you guys, are due to injuries and even sometimes due to disease. And as we age, we're more likely to get certain problems. A couple ones that obviously your screen talks about is number one is glaucoma. Glaucoma is an increase in pressure inside of your eyeball that actually damages your optic nerve. So it damages the ability for you to see. So that's going to be a medical problem that's going to potentially cause vision loss down the road. A diabetic retinopathy is a complication of diabetes, right? It actually damages your optic nerve, again, because typically those patients have those high blood sugars and it can be very damaging to your patients. And then lastly, again, you guys, cataracts. Cataracts is that clouded vision. You guys are going to see this in the field, and honestly, it looks kind of scary at first because you look in a patient's eye and it actually looks clouded over. Their lens looks clouded over. So you're going to need to go ahead and ask your patient, hey, do you have cataracts? Can Can you see out of your eyes? And really assess how much vision loss do they have. If a patient's blind, you're going to have to take the time to explain to them everything that you're doing and everything that's going on so that they feel comfortable. Speech impairment is probably the biggest one as we're starting to talk about some of these sensory impairments. There's so many different types, and it can be resulted from so many different things, whether that's just, you know, as they're growing, maybe that muscles or other things aren't forming fully, or maybe they've had strokes, or maybe they've had other problems that have just made their speech not be able to talk correctly or not be able to form words correctly. So it's really going to be a big change on what can happen with these patients. So some people have a disorder of their voice box and they can't form words that way. Sometimes people just have a hard time producing certain sounds. Sometimes people just having a hard time either speaking languages or even understanding languages, and that could be a problem inside the brain. Either way, you guys take your time to assess your patient. If they can't talk to you or you can't talk to them, troubleshoot, right? What type of tools or what do I have at my disposal to be able to assess this patient in a little better of a situation? Some accommodations, right? You guys are going to have to figure this out on your own, right? For hearing impairments, do they have hearing aids, right? Can they read your lip? Can you communicate with writing? Do they have a language interpreter? Maybe you know somebody who knows sign language, right? Take your time. Don't yell at the patient, but maybe speak louder if you need to. Give them an opportunity to maybe read your lips. With vision impairment, right? Please let them know what you're going to do. If they have a service animal, you can transport the service animal as long as it's not going to bite you or your partner, right? And guide them where they need to go. If you need them to walk, right, don't make them walk on their own. Speech impairments, right? These are patients who are either going to have a hard time understanding you or a hard time articulating what they need to say. So don't ask a ton of questions. Don't expect them to be very wordy. And let them explain it to themselves, right? Don't try and finish it for them, trying to encourage them, because that's going to cut off what your patient is actually feeling. Just because they don't speak doesn't mean that they are not as smart or as intelligent as any other people. So give them some time. Maybe it's better if you give them a notepad and a pen so they can write down some of their answers. Moving on, we're going to talk about cognitive and emotional impairment. Now, there are so many different mental impairments out there. Some of those might be psychosis, maybe some sort of developmental disabilities, or maybe even some brain injuries after a traumatic accident. There's a big span that we can be dealing with here. So, obviously, a patient with psychosis is going to struggle with reality. We talked about that in chapter 26, and you guys can go review psychosis in that chapter. But those patients are going to have really big problems with emotional dysfunction and mental dysfunction. And you need to make sure that if these patients are depressed or anxiety, or if they want to hurt you or other people or even themselves, that we take the necessary precautions to handle those emergencies and situations. Some developmental disabilities, you guys. The list is long, and it can be so many different things, right? Some things that can involve your brain, spinal cord, or even your endocrine system. Things that maybe even before they were born were starting to cause these same developmental disabilities. Take your time with these patients. It's not your job to understand exactly how the disability works and the pathophysiology of the disability. It's your job to give the best care and compassion to your patient, right, while getting a history and a story of what was going on to cause their emergency. So autism is a developmental disability that we could see in the field. So autism is actually identified by seeing the patient's behavior, right? And it's also known as the autism spectrum disorder. Now, it's normally a range of neurodevelopmental conditions that are typically characterized by impaired social interactions or verbal and nonverbal communications. Um, Sometimes you might even see repetitive behaviors in these patients. Some of them it can be due to genetic factors, as well as some of them being due to behavioral factors, even environmental factors. But as best as you can, you guys, they might have a little bit different of anatomy. So make sure you guys are worried about that, and make sure you guys are considering that. And some of these patients might be more likely to develop other medical problems and have other medical considerations, like potentially epilepsy. any patient with some sort of cognitive and emotional impairment, you guys, the biggest thing is treat the patient with respect. I know that's kind of common sense, but you'd be surprised at how often it is to see patients or see even EMTs or paramedics who will get short tempered, right? They're being frustrated because it's difficult to run these calls. It's difficult to have patience with these patients. Uh, Patience with these patients, right? But it really comes down to that, you guys. Respect your patients, respect their family, and just try as best to be patient. I know you're trying to do your job, and sometimes they need life saving care. So make sure that you are compassionate, right? But able to be assertive enough to get things done. It's always good to rely on caregivers or family members as far as history goes for these patients. But remember, do not negate or don't forget about your patients. A lot of times, as EMS providers, right, we're so quick to want to do our job and get everything done that we will quickly run out and we'll go talk to family or the caregivers, but we forget to treat our patient. Some of these patients can be very high functioning and they are able to give us histories, and we don't need to just run off and talk to family members. If we do, we sometimes will neglect our patient and then we'll lose the trust that we have with them. Establish trust with your patients. Like I mentioned, it's always very, very important. And be sensitive to tone, voice, and body language, because these things, you guys, they might experience them or they might it might communicate them in a different way than somebody else. Patients with brain injuries. All right, so this is a quick change in topic here. Brain injured patients. Well, it's exactly what it says, right? These patients have disabilities or even damage to their central nervous system or even the peripheral nervous system due to trauma, right? So sometimes this is due to abuse, sometimes it's due to old medical injuries or swelling inside their head, or maybe even due to a car accident. If you remember at the start of this chapter, right, we were talking about a 23-year-old male who's ventilator dependent, right? He was ventilator dependent because of a car accident that they had 8 years ago. That resulted in his now, right, his cognitive impairment that he had. So these are brain injured patients. Sometimes we consider these TBIs or traumatic brain injuries. Cerebral palsy is an umbrella term for a lot of different motor impairments. They can be genetic and hereditary. They can be developmental or even developmental even before they were born, right, in the mother's womb. But sometimes they're due to trauma, and sometimes they're due to other medical emergencies and things that people have had, but they're motor impairments. As the slide says, right, the degree of impairment will definitely vary among all patients. So find out what's normal for your patient and find out where they're at now. Is it similar? Has it worsened? Is there anything that's going on? Sometimes these patients will have contractures, maybe like a stiffening of a joint, and they won't be able to loosen. Sometimes they'll maybe be twitching, right? Or maybe they won't even be able to move muscles, or they'll have difficulty walking, and they'll have specific devices to help them with this. Talk to your family members, talk to the patients, right? What can we do to help these patients specifically today? And what's their emergency? So, with traumatic brain injuries, it's important to know, right, that this is a huge range of patients. A traumatic brain injury can be a patient with just small deficits after the huge traumatic brain injuries. Maybe they have a hard time with like short-term memory, or maybe they have a hard time focusing, right? Even patients with concussions, technically, that's a brain injury, right? So sometimes they might have some small deficits after a concussion. But it can also range all the way to the other side where patients are maybe in a vegetative state where they're unresponsive and they're on life support, potentially for the rest of their lives. So remember that with traumatic brain injury, you guys, it's a big spectrum, and don't always think of it just as one patient, right? You'll see that patients really do come in all shapes and sizes, and no patient really is ever the same. So treat each patient as they are and make sure you assess your patients. And each situation, each medical scenario, and each trauma scenario is unique. So make sure you handle them appropriately. It's important with any patient with cognitive or emotional impairment that you are able to determine their baseline. What is their baseline mental status? And has anything changed, right? If they're ANO times 2 right now, only alert to person and place, is that normal for them? Because if that's normal for them, then they're not technically altered anymore. However, if they're normally ANO times 2 and alert to person and place, but now today they're only alert to person, right? That's a change in mentation. And we need to know exactly when that happened, right? And as specific as possible to nail down that time of onset. All right, moving on. So far, as a quick recap, we've covered sensory impairments and we've covered cognitive and emotional impairments. Moving on, we're going to talk about another problem that we might run into, and that's paralysis. Patients can be paralyzed for all different types of reasons. The big things that we'll see with paralysis patients is number one, they need special equipment to help them move. Number two is they're more likely to experience other medical problems because of their paralysis. And then number three, right, moving these patients can be difficult. Moving these patients ourselves can be hard, and so we need to counter and we need to have a plan for what we're going to do with these patients. As you can see, that these patients are prone to a number of problems. Some of them might be they are dependent on technology to help them move and get around. But they're also more prone to develop things like pressure sores or decubitus ulcers from just sitting in the same spot for long periods of time. They are also more prone to getting infection, especially bladder infections if they're not able to urinate on their own. And they're also very likely to maybe even develop blood clots because of the lack of movement. So many things that can be done and things that we need to assess for when we're dealing with patients who are paralyzed. If we can, we like to transport whatever device it is that helps them move and get around. That's going to be the device that takes them home. And typically, the hospital will have devices to help them around the hospital. That's not so much the problem. But sometimes getting home and getting them back into their house can be difficult. So we need to transport those devices if possible. However, if it's some huge motorized chair and you guys don't have room for it in your ambulance, well, they're going to have to go without it, and hopefully a family member can bring it down to them. So paraplegia means typically we're dealing with two extremities, typically from the waist down, that are paralyzed. Quadriplegic, right? You guys maybe know is four extremities that are now paralyzed. And we also have hemiplegia, which is unilaterally, maybe just the left side or the right side. Bunch of different types of paralysis. Just follow your patients, you guys, and go ahead and maybe treat them as necessary. When moving these patients, I always think, right, how am I going to move this patient? How am I going to get them from their bed, right, out their house to my stretcher and into the ambulance? Sometimes that's pretty difficult. And it's really easy, you guys, that talk to the patient, right? Who knows more about the patient than the patient, right? They know how to get around. They do it all the time. Just because they're paralyzed doesn't mean they're altered. So talk to your patient. Be like, hey, sir or ma'am, what's the best way to get you out of this house? Right? Or talk to family members and caregivers. Hey, you move this patient all the time. What type of tools or techniques do you recommend for us to move this patient? And typically, family and caregivers are always happy to help. And patients are always happy to be part of the care that they're being given. Some things to look for with paralyzed patients, because they are more likely to have some of these things, are things like feeding tubes, urinary catheters, colostomy bags. Be careful that you are aware of these things before you move your patients. Moving on, we're going to be talking about obesity. Obesity is a huge problem in the United States, so it's very likely that we can run on patients who are obese. Now, bariatrics specifically is the branch of medicine that deals with obese patients. Now, a patient is considered obese when they are 20% or more over their ideal body weight. Now, a patient who is 50 to 100% over their ideal body weight, right, is considered morbidly obese, or a patient who is 100 pounds over their ideal body weight is morbidly obese. It's important that you guys know both of those terms. I'd take a minute to write both of them down. With obese patients, it's more typical that we're going to see a list of medical problems or concerns that goes with these patients. Now, not every patient who is obese is going to have medical problems, but they're more likely to have it. Some of those diseases, and very common ones, are hypertension, coronary artery disease, more likely to have sleep apnea, potentially COPD, diabetes mellitus is a big one, um, and a lot of other diseases that we're going to have to think about, right? We're going to want to get a history on. And have they ever had these problems before? What is their emergency today? The emergency is not that the patient's obese, right? It's that they're having some sort of pain or some sort of acute injury or illness or maybe even trauma, right? So how are we going to help them today with all of these other things that we know about the patient or with the patient's history in mind? This picture is a good picture. The EMTs here are doing a great job treating this patient, and they're doing a good job at keeping this patient seated upright. When we're treating patients with obesity, it's important that we try to keep them uh, in a sitting position or a semi-reclined position, but try to avoid a supine position or a position flat on their back. Patients who are obese can quite easily have difficulty breathing due to just the weight of their chest laying down on the patient, and it restricts their breathing. Some of these patients, due to their anatomy and the changes in their anatomy due to the obesity, can definitely have airway issues. So it's important that you try to keep them in a neutral position. Pay particular attention with these patients of the respiratory rate and tidal volume if you can. Because of the weight of their chest, it can restrict their breathing. Also, if you do need to provide BVM or positive pressure ventilation, it may be more difficult because, again, you have to ventilate against the weight of their chest. Always be careful when moving patients. That doesn't change with obese patients. Make sure you guys use the appropriate techniques, right? Make sure you use appropriate body mechanics and the appropriate tools. Always use enough rescuers. If you need to, call for backup or what we call a lift assist. With bariatric patients, they do have their own specialized uh, equipment. So we might need to call for what we call a bariatric unit. As you can see here, we have a bariatric unit. The cots are typically bigger and can hold up to almost 1,600 pounds. And sometimes these units will even have a winch to help get the patient up in the ambulance, as well as ramps so we don't have to lift the patient. They'll also have appropriate sized blood pressure cuffs and other equipment to help provide appropriate treatment for your bariatric patients. Moving on to our next special patient population, homelessness and poverty. These patients we're going to treat just like every other patient, and that's the key right there, is just like every other patient's. It's typical as just a human being to start to look down or start to pass judgments on these people. That is not our job. As an EMT, our job is to show up, assess, and treat this patient with respect. Some factors that can contribute to homelessness: poverty, substance abuse, maybe lack of housing, mental illnesses, maybe being released from prison, having a hard time getting a job after that, domestic violence, maybe foreclosure on a home, even natural disasters. Patients who maybe are doctors or lawyers, but they have floods or even hurricanes that come through and ruin all the houses in the area. Now they have to be homeless until they can get back on their feet. Some issues associated with homelessness is there's definitely a risk of violence and abuse, definitely increased risk of illness and disease. And with these patients, typically things like tuberculosis, maybe even pneumonia or Hep C, maybe Hep A, and other diseases that we should be paying attention for. And then again, big thing is discrimination from others, and sometimes including EMTs, paramedics, and firefighters. We can also see that sometimes these patients don't have the necessary communication system or suitable needs for employment, so it's hard for them to get back on their feet. Our job, again, you guys, is to just treat this patient with care. Look around your community. As you drive around, try and find the areas where homeless people hang out. Try to find those areas where it's more likely to maybe find them, where you might see homeless people hanging around, and just take note of it. Because if you are working in that area, are you able to identify those areas? If you get called out behind a building or maybe even to a certain part of town, would you know where to look for those homeless people? Sometimes that can help really identify and treat those homeless a little bit better. If we know maybe where they're located or where they like to hang out, or even getting to know them personally a little bit. Any patients who are homeless or facing poverty, right, can definitely face any other issues as any other patient, but may be more likely to develop things like chronic medical conditions, maybe more be victims of crime or even physical abuse. Sometimes they don't even have access to medications because if they're impoverished, they don't have the money to go pay for those prescription medications that they really need. So make sure you assess these patients. And again, you guys, try to treat them without judgment. So, our next patient population is abuse. Something that we need to know about abuse is number one, is it transcends all age, gender, race, and socioeconomic groups. That means abuse can happen to anybody, right? It does not have to be just certain people. There's different types of abuse. Typically, there can be neglect, there can be financial abuse, right? There can be emotional abuse, and there can even be physical abuse, which that could be physical abuse or maybe even sexual abuse as well. It's important, you guys, that we, again, treat all of our patients with respect. It's not your job to get all the specifics and all the details of every single emergency, but try and treat these patients. Think about treating them as the way you'd want to be treated if you were in that situation. It's also not our job to confront the abuser. Our job is to treat the patient and get them to the hospital where they can get the resources and things, and maybe even the police notifying them or letting the nurse or the doctor notifying them to make sure that they can get the help they need if that's the situation. Take your time to go ahead and answer the question. Which one do you think is correct? A, B, C, or D? Another very common situation, one that we don't see very often or one that we don't hear about very often, is human trafficking. Human trafficking is very prevalent here in Riverside County as well as in all of California. You might be thinking, well, what is human trafficking? Right? Well, human trafficking is are people who are victimized, right, or trafficked either into labor or sex work. Again, this is not their fault. Sometimes they're patients or foreigners from other countries, but it is a form of modern day slavery. And traffickers will force or coerce victims into doing what they want, whether that be acts of commercial sex or even labor. And they will be forcing them against their will. As best as possible, what is my job as an EMT in the situation of human trafficking? Is just to try to identify it. If you guys can identify it, that's the first step in the problem. We can notify the National Human Trafficking Hotline, and we can go ahead and call them after the call and maybe get that patient the help that they need. Some things to look for if you're treating a potential human trafficking victim are some of these lists. Now, really quick, I just want to remind you that if you notice some of these things or you potentially think that the patient is a victim of human trafficking, it is best to go ahead and notify the human trafficking hotline. And you can go ahead and Google that number, or you can look it up on your own, or you can find the one in your book. But go ahead and notify the appropriate resources so that they can get treatment that they need. Now, some common characteristics of victims of human trafficking. Very common among our younger population, especially if they're homeless or if they're running away from home. It's very common to see them both in labor and sex trafficking. Any victims of domestic violence, very, very common for them to be trafficked. Victims of sexual assault. Any victims of social discrimination. And victims of war or conflict, which may be one we don't see too often in America. Common settings are some of the ones listed below. But again, not every patient will follow this exact, be in this exact setting. You'll have to go ahead and just talk to your patient. Do you expect it or do you not? And if you're not sure, it's always better and safe to call and report it to the appropriate authorities. A lot of these patients are controlled physically or psychologically by someone, or maybe even some drugs. Sometimes they don't have the ability to leave and will be scared to leave their home. And you think that might be kind of weird. Well, scared to leave their home, that doesn't make any sense. But if the trafficker has threatened to kill or hurt or um, do damage to their other family members, it's going to be scared for them to leave. And they know that they're not supposed to leave or not supposed to go over next to any police officers or maybe even firefighters or EMTs and paramedics. Sometimes they don't have any identification, and it's hard for us to get a name. Some of these patients, you guys, will be addicted to drugs. They'll feel ashamed or guilty of what they've gotten themselves into. They feel guilty or shame because of the things that are happening to them, even if they're not responsible for the things that are going on. They might show patterns of eating disorders, and they might even show evidence of trauma bonding with the trafficker, where they feel like they have to do these things for this trafficker. Keep an eye on physical clues for abuse, which are some of the following. And remember, you guys, always make sure the scene is safe. If you can't transport, contact local law enforcement. If you're not sure that this patient has potentially been abused by human trafficking, then go ahead and report it to the human trafficking hotline. That's the best thing we can do in that situation. If you'd like more information about human trafficking, you can always look them up. Another recommendation I have for you is if you go onto the podcast and you go onto the MCHD, and that's the Montgomery County Hospital podcast. This is an EMS podcast used for paramedics, and they have a episode on human trafficking. Provides good information of what we can look for, different illnesses that we could expect among these patients, as well as what we can do as EMTs to help them. Domestic violence is another group of special patients. Again, you guys remember, any type of abuse, our job is not to confront the abuser. Our job is to treat the patient, treat them with respect, and get them to the hospital. You might see these in specific patients or patient groups. So try to identify those and treat them as necessary. There's many different types of domestic abuse. It can be physical abuse. It can be emotional abuse. It can be just putting the patient down over and over and over. It can even be sexual abuse. It could even be financial abuse. When we think of domestic abuse, for some reason, our mind always jumps to the physical nature of it. But that's not always the case. Again, assess and talk to your patient. Are they showing or exhibiting signs of abuse? Remember, try not to attack the abuser. Our job is to treat the patient. They definitely have a cycle of abuse. Cycle of abuse includes phase 1, where we have tension that builds between the victim and the abuser. Phase 2 is where the violence actually occurs, or maybe it starts to occur regularly, and maybe even starts to increase. And then phase 3 is where the attacker maybe will apologize, right? And they'll try to repair things and make them feel better before they go into phase 1 again. Assess your patients, you guys. Try to assess all of their physical aspects, but also their emotional and psychological aspects as well. That might be something difficult to assess, but look at how the patient's acting, right? What's their GCS and maybe their A&O scale? Do they have a hard time remembering things? Are they shy? Are they scared of dealing with patients of different genders? Are they scared of dealing with patients who are maybe in leadership positions, such as an EMT or a paramedic, or maybe even police officer? Try to assess your patient and look at not just the physical aspects, but as well as emotional and mental aspects. These are some aspects of things to do when approaching a scene and victim of domestic violence. Remember, PD should always be on scene for these situations. Try not to destroy any possible evidence. If you can, in your PCR, Document everything you can. Document the location, description of the injuries, potential mechanism of the injury, note any injury patterns. But as best as you can, try to be objective and objectively note any of the patient's comments, anything that they said or did. All of this in your PCR could be used in the court of law. So, as best as possible, you guys try to document everything that you see. That's it for the first part of Chapter 40. We're going to go ahead and take a break, and you can refer to Part 2 of the Chapter 40. Thank you very much.